My name is LaDonna Taggart, and I'm a family nurse practitioner student with Jacksonville State University, and I'll be the one examining you today. Can you please state your name and birth date?
Jeffrey Taggart, 5/24/73.
Okay, at this point, I will have washed my hands, and before starting the exam, I will place my gloves on. Okay? All right, tell me what brings you into the clinic today.
New patient.
All right, let's go ahead and get. What's going to happen is I'm going to learn some history about you, get your medical history down, and then we're going to just move forward and see what we need to do to get you in today. Okay? All right. So tell me, are you on any medications?
No.
Are you taking any over-counter medications?
No.
Do you have any allergies
No.
to meds, to food?
No.
Any latex allergies?
No.
Any seasonal allergies?
No.
All right, can you tell me if you have had any hospitalizations before?
No.
Have you had any surgeries?
None.
Okay, are you in the military?
No.
Have you been out of the country in the last 6 months?
No.
Okay, tell me, have you experienced any chest pain or anything?
No.
Recently or anything?
No.
Okay, any pain anywhere? Do you have any concerns over your health at this
No.
point? So you're just here to have a physical. When was the last time you had a physical?
2 years ago.
Okay, so have you had any chest x-rays recently?
None.
Have you had, are your immunizations up to date?
As far as I know.
Okay, have you had the flu vaccine?
Yes.
When was the last time you took the flu vaccine?
This year.
Okay, have you had a prostate exam?
2 years ago.
Have you had a colonoscopy?
2 years ago.
Okay, have you had a tetanus shot? Not sure?
Not sure.
Okay, well, we'll check on that. Have you been told that you have high cholesterol?
No.
All right, tell me, now tell me about your mom. Is she still living, or your parents still living?
Both parents are living.
Okay, tell me the ages. Is your mom, what age is she right now?
78.
Does she have any type of diseases or illnesses she's been diagnosed with?
None.
What about your father? How old is he?
76.
And does he have any diseases
No.
or illnesses? Okay. What about your do you have any siblings?
Yes.
How old is he or she?
155.
And how old, is it a lady or?
Female.
Okay. All right. And tell me, does she have any illnesses or anything?
None.
Do you have any children?
1.
Okay. How old is the child?
17.
Boy or girl?
Boy.
Okay. Tell me, does he have any illnesses?
No
Was he
issues.
born prematurely?
No.
All right. Do you smoke?
No.
Okay. Have you ever smoked?
No.
Do you use alcohol?
No.
Have you ever used alcohol?
None.
Do you use illicit drugs?
None.
Okay. Have you ever used illicit drugs? Okay. So let's go ahead. So what I'm going to do is I'm going to start feeling on you. Are you okay with me feeling on you?
Yes.
I will be asking you questions throughout the exam. If you feel any pain or tenderness, please let me know.
Okay.
All right. Okay. Well, let's get started. So what I'm going to do is I'm going to feel, well, your appearance first. You answer all my questions verbally, non-verbally. Everything was appropriate. Hair distribution looks good. I'm looking around and I don't see any lesions or any masses anywhere. Okay. And let me look, your color looks good. Fat distribution, everything looks good. And I'm looking, I don't see any color changes. Your chest looks symmetrical. Breathing looks good. Okay, I'm gonna start out by feeling in your head. Okay, any tenderness, anything around there? Okay, all right. All right, now I'm going to, your eyes, look, your sclera is nice and white. Your conjunctiva is nice and pink and moist. It looks good. All right, and I'm gonna feel around for your frontal and maxillary sinuses. Any pressure, anything?
No.
Okay, I'm gonna percuss. Okay, any pressure or tenderness there?
No.
All right, I'm gonna take a look. Okay, we have Perla. I want you to follow the pen light, okay? We're checking for EOMs or extraocular movements. We're also checking cranial nerve 3, 4, and 6. good. Now what I want you to do is follow in. We're checking for convergence. Convergence is normal. All right, and now we're going to check cranial nerve number 5. I want you to clench your teeth for me. Close. Now I'm going to push against my, okay. That's trigeminal cranial nerve number 5 is intact. Okay, and now I'm going to go around and I'm going to look. If I had my ophthalmic scope, I would be checking his optic disc and checking for retinal changes. All right. Now I'm going to look around here, looking for JVD, jugular vein distension. I don't see any. Right on either side. And now I'm going to check the pinna. The ears look great. All right, they're symmetric, both sides, and I'm going to take a look into the meatus here, and I'm seeing the tympanic membrane. It's nice and shiny and gray, and I'm seeing a little bit of cerumen, nothing occlusive. I'm pulling, because he's an adult, I'm pulling up, back and up, so I can visualize the tympanic membrane. Over here, same. I can visualize the tympanic membrane. It looks to be intact. Just a little bit of cerumen. All right. Now what I'm going to do is I'm going to check your nose. Okay. All right. Doesn't look like you have a deviated septum. If you would try, I'm going to check for patency. Just occlude one side. Now occlude the other side. All right. Patency is intact. Now what I'm going to do is just kind of feel around. Okay. Okay. And what I'm going to do is I'm going to basically feel or palpate his lymph nodes, and I'm going to feel for any abnormalities. I'm going to start here in the preauricular, post-auricular, tonsillar, occipital, okay, submandibular, submental, anterior cervical chain, posterior cervical chain. Okay, do you feel any different?
No.
Okay, I'm going to take a look in your mouth really quick. All right, teeth look to be intact. Gingiva is nice, pink, and moist. All right, put your tongue down for me. Uvula is midline. Tonsils are grade 2. Intact. And now what I want to do is I'm going to palpate your thyroid. If I were to feel any masses at this time, I would just follow up. And now I'm going to listen or auscultate using the bell of my stethoscope to hear any breweries over the thyroid. Okay. Doesn't seem to be any goiters or any breweries that I'm hearing. And now I am going to listen. I'm going to, I'm going to pull your shirt up, okay? All right. I'm looking, and we're going to go cardiovascular. I don't see any visible PMI. And so what I'm going to do is I'm just going to feel over. I don't feel any lifts or heaves, okay? And so now I'm going to take a listen, and I'm going to use the diaphragm of my stethoscope. And I'm going to listen to all the heart areas, starting with the pulmonic. Starting with the aorta, pulmonic, Erb's point, tricuspid, mitral. Okay, everything seems to be intact. I don't hear any thrills or murmurs thing. And now I'm going to listen with the bell of my stethoscope in the same areas. I'm going to start out with the aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, done. So I don't hear any breweries or any extra sounds there. And what have you had any chest pain or anything
No.
lately? Okay, so basically everything sounds normal there. I'm going to move on and you can put your shirt down for the moment, and I'm going to go ahead and listen to your respiratory. Take a deep breath in for me and out. Patient is not having any distress while breathing. His expansion is symmetrical. He doesn't seem to be having any problems while breathing. So have you ever been told if you have asthma?
No.
Okay, so I'm feeling here. Okay, I'm gonna start out, and I'm just gonna listen anteriorly first. Take a deep breath in for me. Out. Deep breath in. Out. Deep breath in. Out. Deep breath in. Out. Okay. Now I'm going to go ahead and I am going to listen to the back. Well, first let me take a look. I'm gonna inspect your back. And what I wanna do is I don't see any lesions or lacs anywhere, and patient, breathe, take a deep breath in for me. All right, and it's symmetrical. So what I'm going to do now is I'm going to just feel and palpate. Are you feeling any tenderness
No.
anywhere? Okay. All right, and I'm gonna put my hands on your back. I want you to say 99.
99.
Okay, 99.
99.
99. Okay, I'm checking for tactile fremitus and everything seems normal. Intact, I don't see is negative for that. And now I'm going to auscultate your lung fields, okay? And I'm gonna use the diaphragm of my stethoscope. If you'll take a deep breath in, out. 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 Deep breath in, out. Deep breath in, out. Deep breath in, out. Okay, and if you'll put your hands over you can leave that up for me. And then I'm gonna listen here. Deep breath in, out. Deep breath in, out. And I'm coming on the other side. We'll do the same thing. Deep breath in, out. Deep breath in, out. Okay, all lung fields are clear. Well, I'm gonna go back and redo that so I'm not in the camera. So deep breath in, out. Deep breath in, out. All right, all lung fields are clear. I don't hear any adventitious sounds. How are you feeling right now? You feeling okay? All right, so now we're going to lay down. Watch your head. Okay, and I'm gonna come back a little bit more. Okay, with the abdomen. Okay, and first we wanna inspect the abdomen and look over. We wanna make sure all I see here, fat distribution is normal. Abdomen is rounded, and all I see is a little bit of striae here on the mid to bottom part of patient's abdomen. Everything else looks good. His umbilicus looks good and intact. And so now what I'm going to do is I'm going to auscultate first, because we don't want to disturb the bowel sounds. Okay, and so I'm going to start by listening to the right lower quadrant here. Okay, and I'm listening for normal active bowel sounds, and they are normal active in all quadrants. Now while I'm here, I'm going to turn the bell of my stethoscope and I'm going to listen to his aorta, his abdominal aorta. And what I'm listening for to make sure that there's no bruits. Okay, sounds good. No bruise, I don't hear anything over the aorta. So now what I'm going to do is I'm going to percuss. And what I'm hearing is tympani, which is what you want to hear over in the four quads. Now, What I would do with this, or a full length exam, I would be percussing all the way up until I got to an area of dullness that would tell me where the liver is. And on this side, it will tell me where the spleen is. So anytime you hear dullness, it's usually over something that's filled with, so basically over an organ. So all of our sounds here are tympanic and normal like we want. So now I'm going to palpate. I'm going to do some light palpation. All right, any tenderness?
No.
There's no guarding. Okay, now I'm going to do deep palpation. I'm going to use both of my fingers, and what I'm feeling for are possible masses. Okay, any tenderness or anything?
No.
All right. Okay, everything is good there. So if you'll sit up for me, let me help you here. All right. Now, all right, what I'm going to be doing is checking your strength against well, I'm going to feel, have you had any pain in your joints?
No.
Have you had any problems with range of motion
No.
or ambulating, walking? Okay, you don't have any concerns with your musculoskeletal?
No.
All right, so what I'm going to do is I want you to press, and don't allow me to, oh, good shoulder strength. That's a 5 out of 5. All right, I want you to put your arms out for me, and what I want you to do is, I'm trying to press, okay? Now push against, good arm strength. 5 out of 5. Do you feel any problems with the joints here?
No.
Shoulders?
No.
Any problems here? Any problems here? Okay, I want you to grab. Okay, hand strength is a 5 out of 5. And then what I want you to do is I want you to press against my hands. Oh, good hand strength, 5 out of 5. Good. And you having any problems with the joints here?
No.
Okay, I want you to take your fingers and just move them around. No, just do this. Okay. Now I want to test you for fine motor. I want you to take it and do to each finger. Okay, fine motor skills seem to be intact. All right, and then I want to just feel I want you to stand up for me real quick. I'm going to feel your hip joints. And you say you haven't had any problems with those?
No.
Okay. Anything in your ankles? Okay, I'm not seeing any edema. This side, I'm not seeing any edema. And while I'm down here, I want to check his dorsalis pedis bilaterally. Want to check his posterior tibial. All right, both pulses are 2+. All right, and what I want you to do is I want you to sit back on the table for me. What I'm gonna have you do is put your arms out and go up and down. Okay, any problems with that?
No.
Okay, and what I want you to do now is put your leg out for me, and I'm checking for lower extremity strength. Okay, good there. All right, lower extremities are 5 out of 5. You can put your arms down. What I want you to do now is take your heel of each foot and take it down, rub it down your shin. That's fine motor for lower extremities. All right, and so what I'm going to do now, I wanted to test your visual acuity. Can you read that?
Associated Credit Union.
All right, visual acuity is intact. All right, and now I'm just gonna check your reflexes, okay? And I'm gonna start out by checking your biceps reflex. And if you'll just hold your arm out, I'm trying to find that tendon. Okay, and just kind of just relax there. All right. Okay, and we saw a little bit what you want to see. There's a little bit of movement there, and okay, good. Now I'm going to check the brachioradialis. All right. There we go. All right, and over here I'm going to check your patella. So if you just put your leg out for me real quick, leg out, and now just let it hang. Trying to find it. Let it hang. Just let it hang loose. All right, here. There we go. Good reflex. Now I'm going to check it on the other side here. Good. I'm going to check Alice here. Good. And we're going to check here. Okay, little bit of reflex. Do you have any questions for me?
No.
All right, so next what we're gonna do is set you up for all the things that you need, all the tests. Next ray, we think you're in the lab work, and we'll tell you when to come back to the office. Thank you for using Shadow Health.
Thank you.
Thank you.